Good, and you?
Good. So we're just going to do a quick, it's called a PAR-Q test. It's like a pre-physical assessment questionnaire, just to make sure that you're cleared and you don't have to get any medical clearance from any other physician or doctor before you can participate in air condition or high blood pressure.
No.
Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity? Do you lose balance because of dizziness, or have you lost consciousness in the last 12 months?
No.
Have you ever been diagnosed with another chronic medical condition? Are you currently taking prescribed medications for a chronic medical condition?
No.
Do you currently have or have had in the last 12 months a bone, joint, soft tissue, muscle, ligament, or tendon problem that could be made worse by becoming more physically active?
No.
Has your doctor ever said that you should only do medically supervised physical activity? Okay, that's all. You're all set.
Okay,
Thank you.
I'm going to take a blood pressure reading to gather information on your baseline cardiovascular status, and then again I'm going to take it during exercise to see how your body responds to physical activity.
When measuring resting blood pressure, seat your participant in a quiet room for at least 5 minutes. The chair should have a back support, and the participant's feet should be flat on the floor. The participant should also avoid smoking cigarettes or drinking caffeine during the 30 minutes preceding the measurement. Measure the circumference of the arm midway between the acromion and the olecranon process to determine cuff size. Palpate the brachial artery pulse on the anteromedial aspect of the arm, which is 2 to 3 centimeters below the belly of the bicep. Have the participant roll up their sleeve or remove their outer shirt to be able to wrap the deflated cuff firmly around the upper arm so that the midline of the cuff is over the brachial artery pulse. Position the cuff so that the lower edge is approximately 2.5 centimeters above the antecubital fossa. Place the stethoscope diaphragm over the brachial post. Be sure that the entire head of the stethoscope is contacting the skin. Close the valve and quickly inflate the cuff to approximately 180 mmHg. Partially open the valve to slowly release the pressure by 2 to 3 mmHg per second. Continue reducing the pressure slowly and note when the metallic tapping sound becomes muffled and when the sound disappears. After noting when the sound disappears, continue deflating the cuff for at least 10 mmHg. If no additional sounds are heard, rapidly and completely deflate the cuff. Instruct participants to not grab handrails or handlebars or exercise apparatus during their blood pressure measures. Wrap the deflated cuff firmly around the upper arm so that the midline of the cuff is over the brachial artery pulse. Position the cuff so that the lower edge is approximately 2.5 centimeters above the antecubital fossa and the tubing is superior instead of inferior. Limit arm movement during the blood pressure measurement. Stabilize and support the participant's arm between your trunk and arm. Position manometer pressure gauge at eye level within 3 feet and arrange cuff tubing for clear viewing of pressures. Place the stethoscope diaphragm over the brachial pulse. Be sure that the entire head of the stethoscope is contacting the skin. Close the valve and quickly inflate the cuff to approximately 180 mmHg, then partially open the valve to slowly release the pressure by 2 to 3 mmHg per second.